something. Yes, so welcome to today's session. As you can see, we'll be covering the pathologies of the genitourinary system as shown there. This is a series on human pathology. Because at this point, you already know me. And we are going to start by talking about the anatomy of the kidney. So at this point, we know that the kidneys are paired, two kidneys, and they are bean shaped. They are bean shaped, and then we have structures at the hilum. So structures at the hilum, we start with the ureter. There's a ureter here. So remember the ureter is now that drains the kidney. So ureters, which is formed by three major calyxes, and then three major calyxes usually formed a major calyx is formed by 3 to 5 minor calyxes. So these are major calyx, and then the ones that go to the renal columns, actually known as minor calyxes. That's a bit to do with anatomy. So just know from minor calyxes to major calyxes, from major calyxes to the ureter. And then what are the functions of the kidney? Functions of the kidney is that you have body homeostasis. Of course, you know homeostasis is the maintenance of constant or balancing of internal environment. And then you have it has excretion function. Of course, urine and that nitrogenous waste. Endocrine function of erythropoietin, renin, and vitamin D3. And then, of course, you can see the components of the urinary system, kidneys, the ureters, bladder, the ureter there. For the urinary system, of course, you know them, kidneys, there, ureters, the bladder, and then you have the urethra. If you can remember when you're doing the endocrine system, you covered the adrenal glands or the suprarenal gland. So this is suprarenal gland, as you can see there. So the functions of the urinary system, one, excretion of waste products, as we talked about the kidney. Two, regulation of fluids and electrolytes, that is homeostasis. Three, regulation of blood pressure. As you will see, most people who have issues with their kidney, they usually have issues with their heart. So if you have chronic kidney disease, it's likely you will have edema, or also you will have left-sided heart failure. And the other one is regulation of blood volume, osmolarity, detoxification of blood. So this detoxification of blood goes hand in hand with the excretion of waste products. Then you have hormone production that actually happens specifically in the kidneys. That is, the hormones themselves are erythropoietin, renin, and vitamin D. And this is actually a very good question that I can ask you. To list hormones are produced by the kidneys. And maybe to tell you to describe the functions of them. And at this point, I'll just ask us to know the three hormones produced by the kidneys. Of course, you've heard about the nephron, and the nephron, to be specific, is actually this structure here. So the kidney, its functional unit of the kidney, the functional unit of the kidney is a nephron. So the functional structural unit of the kidney is a nephron. And we have two types of nephrons. One, you have juxtamedullary nephrons, and these are juxtamedullary nephrons. So they're called juxtamedullary nephrons because they are leukophilic. This part, leukophilic, extends deep into the medulla of the kidneys. And then you have the cortical nephrons that are here. They're just the cortex. Remember, the kidney has two parts: the cortex, the outer part, and the medulla, which is the inner part. So this juxtamedullary cortex nephron has its loop of heavy extending deep into the medulla. And then cortical nephrons, they will form on the cortex. And that's the reason why these juxtamedullary nephrons, we find them in those animals that are found in desert or hot and dry climates, such as now camels. Those animals that are found in dry areas, synthetic animals. And then the animal that you find them in hydrophilic areas, we find them having more of cortical nephrons. And then, of course, now we'll have integrative nephrons. Integrative nephrons will just in between the cortex and medulla. And for the bladder anatomy, just remind us, it's a bladder. Um, it has a muscular muscle, has a smooth muscle known as the tractor muscle. And this bladder actually has a capacity of 700 to 800 milliliters. It is smaller in females, and that's actually something I'd like you to go and check on. Why is the bladder in females smaller? Or maybe talk about its anatomy. And then towards the base, they get a strain in the bladder. And at this point, here is where you'll find the urethral openings. The urethral openings are here, if you can see them. So this base, then you can find this urethral ligaments, iliacal ligament, you can find them there. These are prostate gland males, of course. And this is the bladder. Just to remind us, it's actually found in the pelvis in humans. So apart from you're supposed to know about the bladder here, just to appreciate in males, you have the prostate gland. In females, you would have the prostate gland. You can appreciate these males on our left, on our right. These are females. And you can appreciate in males that they have a longer urethra, which is divided into three parts. So you'll have penile urethra here on the shaft of the penis. Then you'll have venous urethra, and then you have prostatic urethra. Yeah, in females, they just have this small urethra, as you can see here. In terms of the male and female reproductive parts, you need to appreciate the parts of the male reproductive system. We start with the testes here. So testes production of sperms, then vas deferens, epididymis here, which stores the sperms, then vas deferens. From vas deferens, you can appreciate here you have seminal vesicles. From seminal vesicles, you can appreciate the prostate glands. Then you have the urethra here. In females, study the ovary, fallopian tube, or duct. This is the uterus or the womb. This is cervix. This is vagina. And that is now the female reproductive system. This is a male reproductive system. And I presume I've already covered that well in this, the parts of the male and female reproductive system. Maybe just to recap, the testes covered by the scrotum, epididymis, the ductus deferens or the vas deferens, which actually appreciate these are the seminal vesicles here, which join the urethra to get in the vas deferens. At this point, these are prostate glands. Then you can find the urethra there. These are penis, of course. And for the female reproductive system, just to appreciate the various parts, once again, this is the ovary, the fallopian tube, this is the uterus of the womb. The inner part of the uterus is known as endometrium. This is a cervix, this is a vagina. And of course, on the outer side, you'll have now the labia majora and labia minora and the vulva. Maybe that one I can give you an assignment to go and check on it. So this is just a repetition of the same. So allow me to skip it because I've just talked about it, the various parts of the female reproductive system. So I think now we can start to discuss the congenital anomalies of both genitourinary system. And for these anomalies, allow me to show you using images. And the first one that I'd like us to appreciate here is an X-ray image. So here is a kidney, and then on this other side, you can see the kidney. So that means kidney is just present on one side, and that is renal agenesis. So renal agenesis means absence of one kidney. The other one is this one. So one kidney is present, the other kidney is small. What is that? Hypoplasia. So one kidney is big, the other one is small. So renal hypoplasia. Then you can appreciate this is a normal kidney. It is smooth, but now this other one it is having lobules. So that is fetal kidney lobulations, as you can see there. And the other one, you can see like kidneys are supposed to be separate, but in this one, they are fused, giving you horseshoe kidneys. And then once again, you can appreciate this one has kidneys which are separate, but now they have lobulations in them. And then these lobulations, actually these cysts in them, have fluid. And that is what is known as congenital polycystic kidney. Congenital polycystic kidney. The other one is that you can appreciate this is actually the lungs here. These are the ribs. This is a liver. This is a kidney. But not this kidney is actually inside the lungs. So giving you thoracic kidney. This is a thoracic kidney. And then you can appreciate you have two kidneys here. This abdominal aorta, you have two kidneys. These are the lips. So this kidney is actually on this other side. So you have two kidneys on one side. And that is what is known as renal ectopia, crossed renal ectopia. Then you can appreciate these are the kidneys, these are the ureters going to drain into the bladder here. So this on this side you have one ureter, on this other side you have two ureters. And that is what is known as complex collecting system. Then you can appreciate hydronephrosis due to constriction of the ureter. Then just as similar as this, kidneys are fused at the center. So this one is at the inferior pole, sorry. So this is horseshoe kidney. Similar case, kidneys fused at the inferior pole, that is the horseshoe kidney. And then the last one is the pelvic kidney. So this kidney is still in the pelvic region. I talked about supposed to be the abdominal region. So those are some of the congenital anomalies in the kidneys. The point is, in an exam setting, I will ask you to just list congenital anomalies of the urinary system. And this is what I'm expecting you to list and not to describe. In terms of reproductive system, I would like us to appreciate that you can have intersex disorders, and this is suspected, as you can appreciate in this, you can see like penis or maybe the clitoris, but now if you appreciate it, you have ambiguous genitalia here. So that is suspected in cases of atypical genitalia, clitoromegaly, micropenis, severe hypospadias, bilateral and palpable testes. You can be able to appreciate the testes. And then the testes can also be containing an ovary tissue, that is ovotestes. Also, you can have gonadal dysgenesis. But the most common anomaly of the male reproductive system is cryptorchidism. And cryptorchidism is undescended testes. So ideally, during embryology, during development, depends usually the testes usually descend from the abdomen downwards. So failure to descend downwards embryologically gives us cryptorchidism. As you can appreciate on this side, um, the testis is not descended, but on this side is descended. And actually, this is a medical condition. It is an undescended testis. The other one that you need to appreciate is actually anomalies that are due to failure of formation of a lumen between the uterus and the vagina, and that means the cervix is atretic. Remember I told you atresia means blockage. Atresia means blockage. So the uterus is not communicating with the vagina, giving us cervical atresia. On this other end, anomalies of the vagina, one of them being the hymen. So you can have the hymen having various morphologies. One is imperfect hymen. That is when now the vagina can be able to communicate with the external environment, giving us imperfect hymen. Also, you can have annular hymen, as you can see here. You can have septate hymen, as you can see here. You can have cribriform hymen, as you can see here. And also you can have Laras introitus hymen, as you can see here. So those are some of the anomalies of the vagina. Maybe to appreciate also, you can have Mullerian duct anomalies, but these Mullerian duct anomalies, I wouldn't really deliver much on them. So anomalies of the male external genitalia, these ones are important, given that we need to know hypospadias and epispadias. So hypo by the name itself is hypo, so it's below. So you can appreciate this is the ventral side of the penis. So the ventral side of the penis is actually the downward side of the penis. You have the urethral opening not found at the tip, but not on the inferior side, as you can see here. So here, here, and maybe here. So this is hypospadia. The urethral opening is actually found on the ventral aspect and not on the tip. You'd expect it to be here, but it's actually on the inferior side. Opposite can happen, you can have it on the upper side, on the dorsal side, giving you epispadias, as you cannot tell. And yes, now we go to the renal pathologies of the urinary tract, renal pathologies, and we start with urinary tract obstruction. So by just a simple definition, urinary tract obstruction is actually an obstruction that is happening in the urinary tract. So you know the urinary tract is the ureter, comes to the bladder and urethra. So any obstruction that happens in the urethra gives you urinary tract obstruction. And so what can obstruct these urinary tracts? One, renal calculi. These renal calculi are actually renal stones. Two, remember we talked about prostate actually giving a cause of the prostatic urethra. So if the prostate hypertrophies, that is benign prostatic hyperplasia, you have urinary tract obstruction. Also, tumors of the urinary tract of the pelvis can obstruct the ureters and the ureters. Then you can have congenital abnormalities and urethral strictures. So what will happen is that the person will have hydroureter. So this ureters here becomes big hydroureters, as you can see here. So you can have hydronephrosis, and also the renal cortex, this renal cortex will undergo thinning. So the person with urinary tract obstruction will complain of pain, especially on the flank side. Hematuria is blood in urine. Of course, difficulty in urinating, and then reduced urine output. Yes. And then what is renal calculi? Renal calculi, remember we saw this. We said that they're actually renal stones. So what are renal stones? Renal stones are stones that are actually found in the renal system. And they can have various morphologies and comes from various places. So types of these renal stones, we can have calcium stones, is the most common. You can have trophic stones, which is actually infection related. You can have uric acid if you eat a lot of uric nitrogens, nitrates, and you have cystic stones, cystine stones. And all these actually the stones that I'm talking about. And you guys, if you have these stones, what they will give you obstructions. So morphology of this renal calculi is that they're actually small, smooth calculi that will be found in the urinary system. What they do is that they block the urinary system, enabling you to have hydronephrosis. Clinical features, just as renal obstruction will give you flank pain, hematuria, dysuria. Dysuria is pain while urinating, and nausea and vomiting. And the complications, as we talked about, so for example, this one, it will lead to hydronephrosis, it will lead to obstruction, and then it can lead to, due to this stone here, it can be infected with infections. And so with that, we have pyelonephritis, which is inflammation of the kidneys. Yeah, so we go to urinary tract infections. Maybe you've heard about UTIs. So UTIs is actually urinary tract infections. So what are urinary tract infections? By the name itself, it's actually microbial infections involving the urinary tract. So this urinary system, if they are infected, that will be urinary tract infections. What are the causes of these UTIs? Mind you, you can have bacterial causes, fungal causes, but the most common ones is actually bacterial causes. The most common of the bacteria, E. coli. E. coli is known as Escherichia coli, which is the most common. Other causes you have Klebsiella, Proteus, Enterococcus, and sometimes these infections can come from the skin infection and they spread into the urinary tract. Classified into two, these UTIs are classified into two. The lower urinary tract infections affecting the urethra, giving us urethritis. It can affect the bladder, known as cystitis. And also it can affect the kidneys, pyelonephritis. So the ureter and the bladder and the kidneys already gives us pyelonephritis, that is upper urinary tract infections. And just by name, you'll expect, if it's cystitis, you'll expect the bladder to have been inflamed. If it's pyelonephritis, you'll expect the kidneys to have inflamed. And so what will be the clinical features of a person with urinary tract infections? One, difficulty or pain while urinating, dysuria. The person has urinary frequency and urgency. In addition to that, the person will have pain in the flank region. And of course, given that it's an infection, you'll have fever. So complications, recurrent infections, uh, renal scarring, can spread to the body, giving us sepsis and then septic shock. And then if you have chronic inflammation of the kidneys and the ureters, will give you renal failure. Yeah. So let's talk about, so you've talked about urinary tract infections. Let us talk about renal tumors now. So for renal tumors, these are actually renal cancers. We have just two of them. Two renal cancers alone. One of them is renal cell carcinoma. But by definition, it's a renal tumor. Renal tumor is actually any malignancy, any tumor that is arising from the kidneys. And we have two, that is renal cell carcinoma and Wilms tumor. And this Wilms tumor is also known as nephroblastoma, is common in children. So renal cell carcinoma, by the name itself, renal means kidney cell affecting the cells of the kidneys. Then carcinoma is actually a malignancy. And then Wilms tumor by the person who discovered it, by the mutation, the person who found the mutation that happens in the kidneys for a person who have tumor in children, um, found that Wilms mutation. Then renal cell carcinoma, RCC, arises from the renal tubular epithelium. And actually, this one is important that we know about it. So if you're doing a postmortem and then you find such tumors, so these tumors usually like the poles. So you can have inferior pole and superior pole. They usually like the poles a lot. These renal cell carcinomas, and they are highly vascular uh, tumors. That is, they have a high tendency to spread through blood vessels. So they have venous invasion, the renal veins, and the inferior vena cava. Then you'll find a yellow, orange tissue on the kidneys. You'll find areas of necrosis, as you can see here. Also, you'll find there is distortion of the normal architecture of the kidneys at this point, especially in the boundaries. It is invasion of the tumor. So that is renal cell carcinoma. So know about renal cell carcinoma. That is very important. And this is just the same tumor that I wanted to show us here. So this is renal cancer or renal tumor, specifically the renal cell carcinoma, RCC. So clinical features will be the same between um, clinical features will be the same between Wills tumor and renal cell carcinoma. So the features will be the classical triad. So the classical triad will be hematuria, flank pain, that is pain that you have when you have issues with the kidneys, and then also you have palpable masses. So these palpable masses are important because it's actually a tumor. So given it's a tumor, it will be a mass, and that mass you can be able to feel it and touch it, palpate it, palpable mass. And then of course the constitutional symptoms. Other things to appreciate is actually early hematogenous spread. Remember, we say that it has renal invasion and renal vein invasion and inferior vena cava invasion. So it spreads with the hematogenous routes. Hematogenous leads to the blood, through the blood vessels. For the Wilms tumor, you'll have the nephroblastoma thing, which is common in children, and is composed of three cell types of blastema cells, primitive tubules, and stromal tissue. The whole point is for us to appreciate these tumors that are present in children. So if you forget anything that I've talked about these renal tumors, remember we have two types of renal tumors. Renal cell carcinoma that is present in adults, Wilms tumor that is present in children. And then renal cell carcinoma has classical triad, which is hematuria, flank pain, palpable mass. Wilms tumor is actually found in children, and you can see it here. So allow me now to go to kidney injury. And for the kidney injury, what I will do, I'll just help you understand the causes of kidney injuries. The causes of kidney injuries. And you can divide them into three. We'll have pre-renal, two, renal causes or intrarenal causes, and three, post-renal. So renal causes is actually anything that leads to the to like decrease in blood supply to the kidneys. Intrinsic causes means anything that is affecting the nephrons. Then post-renal means anything that is obstructing the urinary system. So by virtue, renal causes of kidney injury is intravascular volume depletion, that you can see here. Hypotension, renal artery stenosis, heart failure, and some drugs such as ACE inhibitors, ARBs, and you can see there. For intrinsic or intrarenal causes, these are now causes that are affecting the nephrons themselves. So we have vasculitis, nephritic or nephrotic syndromes, acute tubular necrosis, and acute interstitial nephritis. This is it. For the postrenal cause is actually any obstruction that is happening to the kidneys. So maybe by the renal calculi or the renal stones, tumors, we talked about the pelvic malignancies, infections, or congenital anomalies due to renal obstructions. And then at this point, so regarding the other things, I will now give you an assignment to go and check on the presentation and the clinical features of renal conditions. Yes. So renal injury, chronic kidney injury, and also stages of chronic kidney injury. I'll give you an assignment also. So I've told you to go and check on causes of kidney injury. Now you divide them well the way I've given you: renal, intrinsic, and postrenal. Apart from that, you discuss the stages of chronic kidney injury. So there is stage 1 to stage 5. Yes. So go and check on those stages. Initially, we require dialysis. So this is it. Now we'll go. We're almost done, guys. We're almost done. Um, almost done. I think with the breast now we'll be done. Well, once we finish with the breast, we'll be done. Okay. So here we go. So what is otitis? So otitis is inflammation of the testes. That is a simple definition. Of course, it can be caused by bacteria, viruses. So otitis is inflammation of the testes. What are the causes? Viral otitis, especially mumps. Bacterial otitis, especially for the people who have urinary tract infections. And also remember STI, sexually transmitted infections, which is gonorrhea and chlamydia. What are some of the causes of um, these viral otitis? I've told us about mumps, bacterial otitis, talked about UTIs and STIs. So what will be the features as you can see here? So one, this one will be reddish, it will be swollen, and then also it will be painful. So you have scrotal pain and swelling. Of course, difficulty in passing urine. Sorry, bronchitis. Then the other one that I'd like us to know is benign prostatic hyperplasia. So by just the name itself, it's actually the prostate gland hypertrophy. It's actually the hyperplasia or the hypertrophy of the prostate gland. The normal prostate in a currently allowing the urethra to be patent, but not in a person with benign prostatic hyperplasia has a larger prostate gland. And so due to that, the person will experience enlarged prostate with multiple nodules, clinical features, of course, due to obstruction of urine here, the person will have hesitancy and weak urinary stream. The person will have increased urinary frequency, and also the person will have urea complete, bladder empty, and then the other person will have bladder hypertrophy. And then hydronephrosis due to back pressure, hydronephrosis due to accumulation of urine in bladder, then bladder is full, the urine accumulates in the ureters, giving you hydronephrosis. Then the person will have increased urinary pressure, the person will have recurrent UTIs. And then the last thing the person will have is renal failure. Remember, due to obstruction. Yeah, so that is it. Before we go to prostate cancer, I would like to give us a break of about um, 5 to 7 minutes. And before we go to the break, it's good we know about this prostatic cancer. And this prostate cancer, if you've heard about it, it's common in males. Of course, females don't have prostate glands. And it's a prostate tumor, prostatic cancer. And most of the time, it affects the posterior zone or the peripheral zone. Um, yeah. So I think with that, it's good that we know about this prostatic cancer. We know how to define it, the clinical features, yes, and then the spread. But I think with that, we can take one break of about 5 to 7 minutes, then we can rejoin. I'll send us the link in the group. Yes, yes, I think we can continue now. I think the other people have seen the link. We can continue. And we were talking about prostate cancer. And this prostate cancer, as we talked about, is actually the malignancies that affect the prostate gland. So by definition, it's actually a malignant epithelial tissue that affects the prostate. And most of the time you see it being referred to as prostate adenocarcinoma or prostatic adenocarcinomas. So of course now the features of this prostate cancer is that you have irregular polydefined lesions that are most commonly located in the posterior lobe of the kidneys. This prostate cancer, most of the time, it can be asymptomatic in early stages, but with time, you'll have difficulty in urinating and we have a weak stream, just as prostatic benign hyperpressure, benign hypoplastic, hyperplastic prostate. Then, of course, you'll have bone pain due to skeletal metastasis. Because if it spreads to the bones, especially the vertebral column, you'll have bone pain. Then all tumor spreads using these three ways: local invasion to the adjacent tissues, lymphatic spread through lymph nodes, and hepatogenous spread. Hepatogenous spread is now to using blood vessels, most of the time veins. That is osteoblastic bone metastasis, the vertebral column. And yes, so this is a prostatic cancer, as you can see here. The other malignancy that we need to know about, not malignancy, is now actually inflammation of the cervix. So these are normal cervix here. So inflammation of cervix is known as cervicitis. And of course, what is leading to inflammation of the cervix? Inflammation. What infections? Infections such as STIs. And most infections here that you can see will be STIs. So these are inflamed cervicitis, as you can see here. So causes of these cervicitis, STIs such as chlamydia, trachomatis, Neisseria gonorrhea, herpes simplex virus, and human papillomaviruses. They lead to cervicitis. Also, you can have chemical irritations. If you have chemicals that go up to the level of the cervix, they can lead to cervicitis. And what will you see? One, if it's bacterial infections, you'll be able to see there is pus. and there is that tissue, the vaginal discharges will be present. And then you can see like, this one is reddish in color and it matters in nature. So in a person with cervicitis, she will have vaginal discharges, postcoital bleeding. After sexual intercourse, the person will have postcoital bleeding, pelvic discomforts, and pain when urinating or having sex deep despite urine. So this pain while passing urine or pain while having sex dyspareunia. Complications of this cervicitis is actually pelvic inflammatory disease, inflammation of the structures of the pelvis, infertility, if infection spreads into the uterus, ovary, and then increased risk of having HIV. Chronic inflammation may predispose a person to dysplasia. Dysplasia is actually the first stages of having cervical cancers, dysplastic cells. And from there now we have from cervicitis, which can predispose you to having cervical dysplasia, which can lead to having cervical carcinomas. Now we are covering cervical carcinomas. So what are cervical cancers or cervical carcinomas? It's actually cancers that affect the cervix. So cancerous tissues of the cervix. Causes of, or what are the features of these cervical carcinomas? What are the features? Once you see this tissue being firm, sometimes fragmentation that bleeds after sexual intercourse. It will be exophytic in nature and sometimes ulcerative. And of course, now the personal time. Sexual intercourse such as cervicitis, the person will have postcoital bleeding. Or the person will have intermenstrual or postmenopausal bleeding. And then the other person might also have offensive vaginal discharge and pelvic pain in a person with cervical carcinoma. So it's actually not a very good condition. The good point is that screening helps a lot. Screening and going for pap smears, especially for the sexually active females. It spreads using the three ways: local invasion, lymphatic spread, hematogenous. So in any case, I ask you about describe the spread of any malignancy, may it be breast cancer, may it be prostatic cancer, cervical cancer, liver cancers, all of them spread using the three ways, majorly the three ways: local invasion, lymphatic spread, hematogenous spread, those three ways. And then the complications of this cervical carcinoma is that they can lead to obstruction of the urethra in females. And also due to, once you have urinary obstruction, can predispose to renal failure, or maybe this renal failure comes across due to obstruction, or maybe also due to spread into the kidneys. And so it can lead to hemorrhages and infections due to this feature is also happening there. And the other thing that I'd like us to cover now is ovarian carcinomas. Just by the name itself, it's actually carcinomas that are affecting the ovaries, cancers that are affecting the ovaries, and they are here. So this is ovarian cancer. So cancer that is originating from the ovarian carcinomas. And of course, they'll be originating from the epithelial tissue that is present in the ovarian cortex. So the gross morphology, of course, there'll be large tumors present in the ovary. Given that the tumors, they are solid in nature, and they'll have nodularity, they'll seem like they are nodules. And then in a person with ovarian carcinoma, most of the time the person will present with ascites. Ascites is distended abdomen. But not everyone who has distended abdomen has ascites. Kindly take note of that. So clinical features of ovarian carcinomas, as we talked about, abdominal distension and cold bloating. The person will have pelvic pain, pain in the pelvis, and also in the lower abdominal region. Also, the person will have early satiety because of obstruction of the intestines. And then the other one is weight loss, as you can see there. So the three ways it spreads: one, transcolonic spread, which is local invasion. Transcolonic spread is actually through local invasion. Lymphatic spread, and then hematogenous spread. And the complications, massive ascites, the person becomes cachexic. And then remember we talked about early satiety due to coming across into intestinal obstruction. And then it is important that you know the tumor markers. And this one is important to know the tumor marker of ovarian carcinoma is actually CA125. That one is important. I'll ask you in an exam setting. What is a tumor marker for ovarian carcinoma, which is CA125. CA125. So almost done, almost done. Um, yeah, I think this that the last thing that we are going to cover today is actually breast cancer. Breast cancer. So you can appreciate this breast. These are actually the lungs. Arterially. Here, it's actually the chest muscles. You can see the ribs. Then there's a breast. So you can appreciate this tumor here. So what will you appreciate for a person with breast cancer? One is a hard, irregular, poorly circumscribed mass. So hard, irregular, poorly circumscribed masses. Then you can also appreciate gray white tissue. So this one is irregular. Actually, sometimes they are very big, very large um, tumors. You can appreciate them when you feel them. That's the reason why the ladies usually urged to palpate the masses. Then these masses might infiltrate the surrounding adipose tissue and skin. Then these nodules is that they will have painless breast lump in terms of clinical features. Painless breast lump will have a skin deeply known as PDRH, nipple retraction sometimes, fixed angular nodes in advanced diseases. So it's actually a common features of breast pathology that we need to appreciate. And this is what now we're calling about a skin deeply. As you can see, skin deeply is present. So the mass is here, the tumor is here, and then you can appreciate there is abnormal reddening of this tissue. But of course, around this, you can appreciate there is abnormal darkening that is happening. And then it's actually a painless. The last thing is actually sexually transmitted infections. And these sexually transmitted infections, as we all know, are actually infections that affect the urinary system and the reproductive system. So urethra, cervix, genital tract, and the urinary tract. And the causes are actually here. So Neisseria gonorrhea causing gonorrhea. Chlamydia trachomatis causing chlamydia. Treponema pallidum causes syphilis. human papilloma virus causing cervical cancers, and herpes simplex leading to genital ulcers. And the predisposing factors of having STI is actually multiple sexual partners. So having more than one sexual partner, inconsistent condom use, severity of your partner's infection. So if you have sex with a person with multiple infections or severe infections, it will predispose you to having STIs, prior history of STIs, and then alcohol or drug abuse. So pathologies of these STIs, how will it present? It will present with no features of cervicitis that is talked about, features of urethritis, inflammation of the urethra, features of inflammation of the bladder, cystitis, all those, it will be combined features, especially if it's um, severe infections. And so clinical features now will be dysuria, pain while passing urine. The person might have urethral or vaginal discharge. The person might also have pelvic pain, genital ulcers or warts, infertility in chronic diseases. And so the person might have complications such as pelvic inflammatory disease, pregnancy, infertility, cervical cancer, which is caused by human papilloma virus, and then neonatal infection, especially known as Neisseria gonorrhoeae, which can lead to neonatal Neisseria ophthalmicus from infection of the eyes of the newborn child by the Neisseria gonorrhoeae. So types of STIs, you can see them here. So chlamydia, gonorrhea, genital herpes, hepatitis B, HIV, HPV, syphilis, trichomoniasis. All these are actually types of STIs. Yeah, and with that, I just wish you all the best. Remember God, hard work, and patience. Um, yeah, also feel free to go and check out the other recordings for the previous sessions in our YouTube channel. Feel free to go and do that. Also, this recording will be posted there. So feel free to go and check it out. Remember Philippians 1:6. Yes, being confident of this, that he who started a good work in you will carry it to completion. That the good work that you've started learning all these, working for yourself, maybe for your family, yeah, God will carry it to completion. And with that, I have nothing other than a thank you to you, a very big thank you, and see you in the next lecture.